Some of you I've definitely seen before. So my name is Hannah Kearney. I'm a medical student at McMaster at the Niagara campus. I'm in second year. And so a little bit about me, my background is I have a bachelor's degree from McMaster in life sciences, and then I also have a master's in psychology from McMaster as well. And so I'm excited to be here with you guys today to talk about out-of-hospital AED use and cardiac arrest, and I will introduce my partner, Alicia.
Hi, my name is Alicia. I'm also a second-year medical student at McMaster University, just at the Niagara campus.
Is the microphone working there?
It's just for the TV.
Pardon?
It's for the Kojiko recording. It doesn't actually amplify in the room.
I can talk about it. So I did my undergraduate and Bachelor of Science at the Vancouver Island University in BC, and moved here just for school. And we have Dr. Seneschal joining us. She's an emergency medicine physician at the St. Catharines General Hospital. She's one of the preceptors for McMaster University and will be teaching us as we move through our emergency core rotations. All right. So we're going to be talking about out-of-hospital cardiac arrests. We have other people on the team that unfortunately couldn't join us. We have Dr. Ryan Chadwick, Dr. Sarah Chadwick, Dr. Keel Elliott, as well as Dr. Rebecca Haworth. So we're going to break the talk up into a couple sections. I'll be starting off talking about what a cardiac arrest is, who it's affecting, and the different types. Hannah's then going to take over. She's going to go over some interventions that people like yourselves can be doing to help improve cardiac arrest outcomes, such as automated external defibrillators, so AEDs, as well as going over a project that we've been working on for the past several months in the Niagara region. And we'll leave time for questions at the end as well. So cardiac arrests. So what is a cardiac arrest? In order to go over that, you have to know the role of the heart itself. So for the heart, its job is to contract. It needs an electrical impulse in order to pump blood throughout the body. And it's bringing oxygen and nutrients to all of the tissues and organs like your brain, your lungs, your skin, and even back to the heart itself. In order to get this heart to contract, you need an electrical impulse. You need that spark. And that comes from these specialized cells within the heart called pacemaker cells. And they send this electrical impulse to all of the cells, and they all work together to contract, and that's what's going to get the blood flowing. A cardiac arrest occurs when that electrical impulse is interrupted, or it's firing incorrectly. So what happens with this is when the heart doesn't contract, it doesn't get that spark, the blood's not flowing, oxygen's not getting to the tissues, and if it's not reversed, that tissue and that organ will eventually die. And this can be caused by things like coronary artery disease, which can be due to plaque buildup within the arteries themselves. It can be due to heart attacks, so when you get the blood clots. It can be due to heart defects that you're born with, or things that you develop just later on. So you may have heard more often of heart attacks versus cardiac arrests, and what is the difference? And truth is, they're actually quite interconnected. So a heart attack is a mechanical problem, and a cardiac arrest is an electrical problem. So with a heart attack, blood flow back to the heart is interrupted. So whether that's a blood clot or just a buildup of kind of plaque, blood flow is stopped to the heart. It's not getting oxygen, and that tissue will die. It can either be a small portion of the heart or the heart entirely. And this will eventually lead to a cardiac arrest because dead tissue does not pump, it doesn't contract, there's no electrical impulse going through dead tissue. So there's different types of cardiac arrest. And when the heart contracts, this electrical impulse can be monitored on different monitors that we have in the hospital, in ambulances. The bottom strip here, called a rhythm strip, is what's produced by a normal healthy heart. And each of those little spikes, those peaks, are the heart contracting. And they're occurring at specific intervals at a healthy rate. However, when you have a cardiac arrest, the top two rhythm strips are what can be produced. So the top one is called ventricular fibrillation, and the one right below it is called ventricular tachycardia. And these occur when the electrical impulse is either interrupted or it's firing erratically. So the heart is just fluttering, it's quivering, but it's not actually squeezing that blood through. And these, the top two, are what you're looking for in a cardiac arrest when you want to shock a heart back to the original rhythm. So going into a little bit of statistics of who this is affecting, approximately 40,000 Canadians each year lose their lives to sudden cardiac arrest. This is about one person every 12 minutes. Another way to put it is if there was 1,000 adults all over the age of 35 in any kind of location during the day, would experience one cardiac arrest every 5 years. And these causes can be broken up into two different categories, both primary or secondary. Primary cardiac arrests occur within the heart. So these are your sudden collapse patients. These can be due to heart defects that you're either born with or to rewiring of a system that's not appropriate for life. Secondary cardiac arrests, though, occur outside of the heart. So this is drowning victims. This is asphyxiation, choking. Because if the lungs aren't getting oxygen, then the heart's not getting oxygen either. It can also be caused by narcotic use, opioid use, like fentanyl and morphine. If they're taken inappropriately at a high enough dose, they'll depress the respiratory system and cause you to stop breathing. So cardiac arrests do become more common as you age. However, they're still affecting children, young adults, and teenagers. For children, causes are generally secondary. So that's drowning, that's choking, and the outcomes are very poor. However, in young adults and teenagers, the causes are generally primary. So those are the ones that are occurring within the heart. Those can be things like hypertrophic cardiomyopathy, which is when the heart is restricted and can no longer pump. Can be due to things like Wolff-Parkinson-White syndrome, which means there's an alternative pathway for the electrical signal, and it's firing incorrectly. It's not contracting. There's no blood flowing correctly. And these have a better outcome when people use automated external defibrillators, which is what Hannah's going to be talking about.
Okay, so now that Alicia's kind of gone through some of the background about what happens during a cardiac arrest, I'm going to talk about some of the options that there are for if you witness a cardiac arrest or cardiac event outside of the hospital. Okay, so just to kind of start off, something that everyone should know in a situation where you might be a first responder is that you are protected by legislation in Ontario. So there are two pieces of legislation that are kind of relevant to this situation. So the first is the Good Samaritan Act. So this basically protects anyone providing first aid, provided that they're doing the best of their ability and not acting in gross negligence. So for example, if you've been trained, if you've done CPR training, it just means that you're basically following what you were taught and that you're not doing anything kind of wild or out of the ordinary in your attempt to protect the person or help the person. The second is the Chase-McEachran Act, and so this is specific to AED devices. So this is named after a young boy who lost his life after experiencing a cardiac arrest in a hockey rink. So since that happened, his parents have kind of championed this movement to have AEDs in all hockey rinks, but then to also protect users of AEDs. So this means that same thing, as long as you're using an AED in good faith, using it the way that you've been trained, you're protected in terms of like legally. Also, if you're a business owner or if you own a building where there is an AED, as long as the AED was obtained in good faith and is being maintained, it means that the business owner or the person who owns the property cannot be sued or is not liable for any harm that comes to the victim if an AED is used on their property. So some things to think about if you witness a cardiac event out of hospital is this, so the cardiac chain of survival. So the kind of steps of the cardiac chain of survival start with early intervention. So like I'll talk about in a little bit, early kind of intervention and early help is what basically improves outcomes the most. So early intervention and then calling 911. Although you can do CPR and you can use an AED, it's really important that you're getting people with more training involved, so paramedics and eventually emergency physicians in the hospital. CPR, which I'll go over in a little bit, defibrillation, which is used done by an AED. ACLS stands for Advanced Cardiac Life Support. So those are the things that the paramedics might do in the ambulance. So giving oxygen, giving medication, maybe providing more defibrillation if needed, as well as the treatment in the hospital. And then there's also post-resuscitation care, which might be done somewhere like the hospital or a rehab center if people are kind of coming back from a cardiac event. So when it comes to factors that kind of impact patient outcomes, the two most important things are early AED use with CPR and using CPR. So if you use AEDs in combination with CPR, your chance of survival goes up to 75%. So obviously still not 100%, but a lot better than if you were to do CPR alone. In addition, the speed in which you apply the AED and actually administer the shock makes a big difference in how people kind of recover from the cardiac event. So for every minute delay since the cardiac event, the chance of survival decreases by 7 to 10%. After more than 12 minutes of being in a rhythm called ventricular fibrillation, your chance of survival is less than 5%. So although it's not important for a bystander to know what the rhythm is, it is important for people to know where the closest AED is and also try to get it in a timely manner in case of emergency. Early AED use also improves the chances of a better neurological outcome, just because if your heart's kind of back and kind of going back to normal, in terms of oxygen circulation, your brain is getting more oxygen versus just CPR. And so in terms of CPR, the guidelines change quite frequently, but before it used to kind of be recommended that you would do breaths as well as compressions. The new literature is coming out that compression-only CPR is an okay alternative and actually equivalent in terms of survival rates. So with just chest compressions, you're doing them at a rate of about 100 compressions per minute, which is pretty fast. So make sure that if you're the only person there, do your best, but obviously if there are other people there, you can train other people by verbally walking them through it and have other people kind of take turns doing CPR, as it is a vigorous activity. And so another thing to consider is that women are much less likely than men to receive help in event of cardiac arrest. And so people tend to be more hesitant about approaching women who look like they're in distress and actually doing compression-only CPR. And so it's important just to keep in mind that women are just as likely to have a cardiac event as men, and that if you see someone in distress, even if they're a woman, you should still consider cardiac arrest as something that could be going on. So Alicia talked a little bit about how even young people can have cardiac arrests and need an AED. And so with AEDs, there are two sets of pads that come with it. There are adult pads, which are larger, but there are also kind of pediatric pads, which are a little bit smaller. The rule for AED pads is that they can never be in contact because you need some space for the electrical signal to go from one pad to the other. So if they're touching, it's not very helpful. Sometimes there's some hesitancy about if you can use an adult-sized pad on an infant or on a child, and the answer is yes. Even in a situation where you've got a baby under the year of 1, if all you have are adult AED pads, and provided that they're not touching, you can still use the adult pads to try to resuscitate the infant. So the only difference between the adult and the pediatric pads is the size and the amount of electricity that travels through them. However, in case of emergency, you have to think that because they're in a fatal heart rhythm, any electricity is going to give them the best option and best kind of outcome overall. So using adult pads is okay on children and infants. Children tend to do better in terms of cardiac or CPR and AED use, and as well because they're most of the time it's not cardiac, it's a secondary cause. So for example, choking or respiratory, maybe too much mucus. In situations, so if you've got grandchildren or nieces or nephews, if you have appropriate PPE and like protective devices, rescue breaths should be done as well, just because they need the oxygen because it's most likely a respiratory cause. So in terms of other things that are kind of out there right now, there are a couple other things that people use to try to resuscitate someone in the event of a cardiac arrest. The first one is ECMO, and so basically in this situation, this normally happens in hospital, but it's beginning to be used by EMS in some areas, where there's a pump that basically moves your blood through an artificial lung and then back into your body, so it kind of bypasses your own system. This isn't used super frequently and definitely not in the Niagara region and their EMS, but it's something to be aware of. There's also something called the Reboa, which is in cases of internal bleeding. It's basically a balloon that gets inserted and that can be inflated to kind of maintain your blood pressure and hopefully avoid a situation where you would enter cardiac arrest. And then the last is automated CPR. So it might be a little bit hard to see with the glare in this photo, but basically it's kind of like almost like a rainbow-shaped object that's going over the person's chest. And this is a battery-operated device that performs compressions at an appropriate rate, so around 100 beats per minute. And so obviously this takes some of the legwork out of doing CPR, and it becomes less physically intensive because the machine does it for you. So this is something you might also see. So just a little bit more about AEDs. We've kind of touched on them briefly. There are a lot of myths about AEDs, and then there's some hesitancy about whether or not an AED will shock someone who doesn't need to be shocked. And so within every single AED, there's a device that basically decides whether or not the person needs to be shocked or not, or does not need to be shocked. And so there's no way for you as a bystander to override that system. As long as you're putting the pads on appropriately, the machine will let you know whether or not a shock is required. If the machine says a shock is not required, you can't do anything to bypass it. It'll give you instructions about to do CPR or what to do next. So it will not shock a person who is in flatlines who has absolutely no heart rhythm. The AED is really to shock people out of rhythms that are abnormal. So like Alicia mentioned before, rhythms where your heart's kind of fluttering and not actually contracting fully. And it will also speak out loud to you. So the best thing that you can do is if you kind of panic and if you need an AED, just open the case and turn it on and it will speak to you and it will tell you what to do. So just listen to the instructions that it's providing. Okay, so now we're gonna play a short video for you. So these are done by the Red Cross. We've got one video about how to use an AED and then also another video about how to do CPR. I'm not sure how this is. Oh. Oh, there we go. I'm not sure what happened to the sound. I think there are subtitles. So I'll kind of walk you through as we go. So this is an example of a defibrillator. And so, like I mentioned before, the most important thing you can do is turn the AED on. Some have covers and some just have a button that you would just press. And so in the kit, you'll find a couple things. So you'll find the 2 pads. There might be an adult set and a pediatric set. You might also find a razor in there, and that's for situations where the person has so much chest hair that you're not actually able to adhere the pad to their skin. So you peel the backing off, it's kind of like a big sticker, and the pads have pictures of where you need to place them on the person's chest. And so the AED, once it's given a shock, will tell you whether or not to continue CPR or whether or not to kind of watch and wait. So let's say, for example, you gave a shock and the person's heart rhythm returned to normal. The AED might just advise you to kind of watch and make sure that the person's okay. You always leave the pads on. EMS will often take the AED with the patient in the ambulance, and that's okay. If you're at a public place and they want to take the AED, let the paramedics take it with them. Just so that way you're not putting the pads on, taking the pads off, and doing that back and forth. Okay, and so now I'm just going to show you a video, if I can get it to turn on, about how to do compression-only CPR.
Check the volume on the sound.
So the volume is fine on this, but I'm not sure about. Oops. Here we go. I can see if it's the computer. through how to do compression-only CPR. So same thing as we talked about before, you're aiming for about 100 beats or 100 compressions per minute, and calling EMS and by calling 911 is always the first step. So with compression-only CPR, you're going to put one hand over the other and interlace your fingers, and you're going to use straight arms and try to use your whole body to do compression, so not just arms only. You do need to depress the rib cage about a third, so it is a pretty significant compression, and you need to let the chest recoil before doing another. And then this video is also just outlining the importance of bringing an AED if there's one available as soon as possible.
How do you get it so fast? Like 5 or 6 minutes isn't very long. Like if somebody had a cardiac arrest here,
Right.
to go and find it and then get it back in, or something, you've got 4 minutes gone already.
That's a really good question. I almost could have paid you to ask that because I'm going to tell you how you can find them in the next slide. So hold on, let me pull this up. I'll show you one thing that we've been working on. Okay, so what we're going to talk to you about, and kind of the reason why we asked Dr. Brown to be here today, is to talk about an initiative that Alicia and I have been working on with a couple of the family medicine residents that she talked about before. So, like this gentleman's question, knowing where an AED is can actually be pretty difficult. So in some other places, so for example in Seattle, Washington, they have a law that states that every AED in the community needs to be registered to EMS. So if you call 911, they can tell you where one is. However, the same thing doesn't exist here. And so one of our goals has been to kind of find where AEDs are in the community and basically pick a program or pick a platform to document them so that in case of emergency, people can actually find where these devices are. So it's a quality improvement group, and our goal was kind of to log as many devices as we could, which involved us contacting a lot of businesses, schools, churches, community centers, things like that. Whoops, I went the wrong way. Okay, so in a pinch, generally your best options for finding an AED, or if you're wondering where one might be close to your house, fire stations, community centers, libraries all have them, as well as public schools. Obviously, if it's outside of school hours, going to a school can be a little bit difficult because no one's there. But community centers, libraries, fire stations, those are all places that you can kind of look in your neighborhoods and try to find an AED. Fire stations, sometimes it's a little bit tricky. If you call 911, they'll come, but their AEDs are also on their trucks. So just make sure, maybe in your like local fire hall, that they ask if they have one, because I know in Thorold, they're all in their trucks. So if you get there and there are no fire trucks there won't be an AED. So what we've done is use PulsePoint, which is a smartphone application. So they have it for Androids, they also have it for iPhones. And basically what it allows users to do is to geotag AEDs. So what we've done is we've contacted businesses, we've gone to schools, we've gone to other places. And when we find an AED, we mark it on this map using the smartphone app, and we take a picture of where it is. There's also typically a one-sentence description of where you can find the device. So for example, if it was in a library or in a hockey rink, we might say by rink pad 1, just so that way if you ever need to access it, you're not running around the rink frantically trying to figure out where in this large building that it is. So anyone can use this application. The application's free to download. Unfortunately, I don't believe you can access it from a computer. I think it needs to be from a smartphone. But if you have an iPad or anything like that, the application should also work there as well. And then one of our co-residents made this video. I won't play it because she talks out loud, so unfortunately, because the sound isn't working, it wouldn't really be that useful. But basically, it's just outlining our project. So again, we've done most of the St. Catharines area and kind of a little bit into Grimsby and a little bit into Niagara. We've found 56 so far that we've marked down. We're still going through and contacting all of the schools, but if you're someone who goes to church, it's important to know where these things are. Most churches have them, but yeah, definitely public libraries, and then I think some grocery stores also. Okay, so I'm so sorry the videos didn't work with sound, but that's all that we have for you folks today. If you have any questions, we'd be more than happy to answer them at this point.
What kind of maintenance is required for the AEDs? You mentioned in there that they need to keep it maintained or whatever. Is there anything we can do?
Yeah, so if you're looking at getting an AED for something that you're involved in, I believe the maintenance is yearly, if not slightly less than that. I think someone often will come and check it. Because they are battery-powered devices, you have to check the charge of these devices pretty regularly, maybe like every couple of weeks. I'm not sure what the exact standard is, but making sure that it's well equipped also. So if it's been used, making sure that you have adult pads and pediatric pads, things like the razors, like I mentioned before, for people that have chest hair where you can't adhere the pads down. I believe in terms of like changing the battery, though, it would be pretty infrequent. But if you do have one, it is to be protected by the Chase McEachern Act. You do need to maintain it. Yeah.
Is it not the law to have it in every school?
In every school? Yes. So there is a law that there are in all public schools. Where they are, though, it depends on the school. So sometimes they might be by the front office, and sometimes they might be by the school gym. When we were talking about it in terms of our research project, we considered those to be fairly like low quality AEDs, just because of the hours of the school and how high school security is now. It can be hard to gain like entrance into a school quickly, because you often have to talk to the secretary or get buzzed in somehow. And then just because the hours of school often aren't very all-encompassing, if you had a cardiac arrest at 6 p.m., a school might not be the best solution. Yeah, especially summertime as well.
Christmas.
Yep, anytime
Easter.
holiday. Yeah. I mean, we do know one story of someone who broke into a school to get an AED and was not charged, but obviously that was a one-off.
We don't recommend that.
We don't recommend that. Yeah.
The company that sells or makes these
Mhm.
AEDs, do they not provide a maintenance service?
So I'm not sure what the actual
I'm not sure
maintenance
about that.
is. The only experience that I have with one was when I used to work at a pool, and I know that it was our job to check the battery, but I do believe that there are maintenance people you can contact. Another good resource if you're looking for where AEDs might be in your community, there's an organization, I think it's Mikey. I think Mikey has AEDs. I think it was another young child who lost his life to cardiac arrest and there not being an AED. So some Mikey AEDs are actually in the community, and so you might be able to see if one's in your neighborhood already.
There are two at St. Mark's
Are there?
in Old Town.
Yeah.
One
So-
in that church and one in the parish hall.
Okay. And so that's the thing, like we recommend that for everybody. It's really important to know where the nearest one is to school, maybe somewhere you volunteer, a recreation center that you attend, a church. It's important to know where they are, so that way in case of emergency you're able to find one as quickly as possible.
Are they in shopping malls?
So it depends. There is one at the Pen, and I believe there is one at the outdoor outlets as well.
That is so big.
Sorry?
There is one at the show festival.
Okay, wonderful. Yeah, and you'll find most gyms also have AEDs as well, but they can be difficult to find. Yeah.
Does, when you open the door to get the AED equipment out of the cabinet,
Yes.
does that opening of the door automatically call emergency services as well?
No.
It doesn't?
So a lot of times them being mounted on the wall in the boxes is just to prevent people from kind of messing around with them. It will not, it might trigger an audible alarm, but most of them will not call EMS, so you would still need to call on your own.
Okay.
Or have somebody else call for you.
Are there any instances with cardiac arrest or heart attack that where it's like a instant, like there's nothing you're gonna be able to do for that person, like at all, like I was talking about, like no pulse or whatever, but if there's no pulse, should you be doing CPR, like that?
If there's no pulse, you should be doing CPR. However, if you're thinking about actually the shock itself, is that what you mean, or just CPR in general?
No, it's like in the sense, I remember years ago, my father passed away, like he was in a restaurant, but, it was, they said it was like an immediate, like you just sort of did, that was, it just collapsed and that was.
If there's no pulse, initiate CPR.
So I think, like in terms of like situations or cardiac events that are maybe, there's nothing you can do, even if they were in hospital, their outcome wouldn't be great. Using an AED early, putting the AED on them and continuing to do CPR until EMS comes is really the only thing that you can do, and it's really hard to gauge how severe a cardiac event is as an untrained bystander, or even as a trained bystander just from the outside. You need a lot of investigation to figure out how bad it actually is.
And what about, like, if someone, what about, okay, it's sort of different, but similar, I guess, stroke is brain, isn't it?
Mhm.
It's different.
What is the average response time of the EMS in Niagara-on-the-Lake? You know?
I'm not sure what
No.
the average response time is, unfortunately.
It's more than 5 minutes.
Yes, I would probably say in most situations it would be longer than 5 minutes. I think it depends on the day.
Are all irregular heart rhythms equally serious or are some not?
This might be a good question for you as well.
It's a really good question.
there's many different abnormal heart rhythms. It's nice that there are some that you can shock, but some of them are incredibly dangerous where depending on what type of medication that you give, that it can make the rhythm go so bad that it's not gonna be compatible with life. But most of the time we can treat them with some medication that help to slow down the heart and that also help to thin the blood a little bit to help to prevent clots. Like blood clots for strokes, which is if anyone has atrial fibrillation, you're probably on at least a baby aspirin or Plavix or other medicine that thin the blood a little bit, so that there are some ways that we can work around abnormal heart rhythms, usually. And the ones that are deadly are much more rare, but you know, we're trained to search for them on the ECGs, that heart tracing.
Yeah.
If there's no one around, is it best to do at least 1 minute of CPR before leaving the person to call EMS?
So, right now, with cell phones, if you're ever in a situation where you're not sure whether or not to start CPR or to call using your cell phone, putting your cell phone on speakerphone and calling from there is a reasonable option. If you were going, if you're going to leave the person, it's best for you to roll them on their side. So it's in what basically called recovery position. You're gonna roll them on their side and use one of their arms and one of their legs to kind of tripod or prop themselves up.
Which side or what?
It doesn't matter what side they're on. The whole idea is by rolling them on their side, you're just not leaving an unattended victim on their back, just in case they were to throw up, then they could start choking and things like that. If you roll them on their side, if they were to throw up, it'll drain on its own and hopefully kind of reduce the risk of secondary issues because of that.
But should you do like a minute of CPR to try to get the heart started before going to call if you have to leave?
You should call for help first, actually. And the best thing to do too is if, like, let's say you're alone in your house, let's say that there's no phones, but essentially the most important thing is to find someone, anyone, and just sort of point at someone. Let's say I'm gonna point to you and say, you, call 911 now, please. You can't say, someone call 911. That usually doesn't work. You get that dispersion of responsibility. So the most important thing is to find someone, point at them and say, you, call 911, I need help now. So that's even like if, let's say someone collapsed, finding the AED, saying, you, find the AED, and then you run out and get the AED. So when we're stressed, we need be very mindful with tasks. So excellent question though, right? So it's tough to tell, sometimes you'll be futzing around with what's going on with the person in front of you, but if you're concerned, call for help immediately, then go back to attend the patient. You can start CPR right away.
Any other questions?
How do you know the address where you are?
Of where you are?
Yeah.
So it depends on the situation. I know, for example, when I used to work at a public pool, sometimes on the AED or even on the wall, it'll actually tell you the address. In situations, I think it's just your job to do the best you can to describe where you are in the building, especially if you live in a building like a condo or where there's multiple units. Describing to the best of your ability where you are can help. Also, if you have a cell phone, using a cell phone can also help the person answering 911 try to figure out like where you are based off your GPS from your phone. But yeah, I think it's mostly just describe to the best of your ability. If you're on the 10th floor, room unit numbers, things like that can help. Okay. Well, if there are no more questions, thank you so much for coming. We really appreciate the support and we hope you guys have a good afternoon.